Welcome. Our experts are here today again, Graciela, Jaschek, Sarah Bass, Krys Johnson, and Heather Murphy. I'm Laura Siminoff. I'm the Dean of the College of Public Health at Temple University, and all of our faculty here at the Temple University College of Public Health are here to discuss a variety of questions that were raised at last week's live panel session. That session generated so many questions that we didn't have time to answer them all. So hopefully we should get to some of the ones that were the most common and seemed the most pressing. So to hear last week's panel, to view other videos and links to all of our information, all of it reliable, please visit cph.temple.edu/coronavirus. So let's start with Krys. Krys, it's allergy season, as many of us know. How do I know if I should be tested for COVID versus maybe I just have seasonal allergies?
So the way that these allergies versus coronavirus manifest is a little bit different. So with coronavirus, you normally start with having a high fever, then a dry cough, and that progresses to a shortness of breath. And so you see that progression of disease. With allergies, you really normally start with sneezing and kind of the headache and pressure in the forehead, and that progresses to a lower level fever. Some other studies have also found that loss of the sense of smell can actually be a pretty good indicator of whether you actually have COVID. Of course, that is whenever you don't have congestion or some other reason that you might not be able to smell.
Okay, well, that's good information. Could you talk to us about the second wave we keep hearing about? Will it be as severe? Can we expect this to become a seasonal illness like flu where it just returns every year?
So keeping in mind that we're building off of previous information, it is important to note that these pandemics do tend to continue as long as people are still susceptible to the infection. But with what happened in the 1918 influenza pandemic, there was that initial first wave in the spring, and then the second wave occurred in the fall. So that's kind of what we're expecting here. And in 1918, that happened around the October-November area. In that case, the outbreak in the fall was actually more severe and, of course, more deadly. With the flu, though, we can have prolonged immunity to it, but with coronaviruses, just looking at other coronaviruses that we know about, we're not sure how long that immunity lasts. So it's very possible that this coronavirus could come up every year like the seasonal flu does, and we might have to get a vaccine for COVID every year, just like we would for the flu.
Okay, so that brings up the issue about what sort of protective behaviors we just need to keep performing. And so Heather, there's now some talk about wearing gloves in public. What's your recommendation? And especially, how does that pertain to shopping? And specifically, most people are worried about grocery shopping.
Yeah, Laura, I think the conversation around gloves is interesting. And as I walk around the city, I see a lot of people wearing gloves just out in public. And my opinion is that there's no need to wear gloves if you're going out for a walk, because it gives you a sense of false security, I guess, because the behavior we're trying to stop is you touching your face with your hands. And so that is, if you're wearing a glove or if you have a dirty hand, either way, if you touch your face, you're still transmitting the virus. So the gloves really don't help you. I know people think wearing gloves in the grocery store is going to protect them, but the same thing would apply by touching something that's contaminated and then maybe touching your face. So the best practice is still washing your hands or using hand sanitizer instead of wearing gloves, and save those for the medical professionals that need them.
Okay, so in terms of cross-contamination, when we are doing grocery shopping, what would you suggest that we do?
I think you want to be conscious of where you're putting your hands when you're in the grocery store. So if you are going to take a cart, often they have wipes that you can wipe down your cart before you then put your hands on. Then when you're going to pick out your produce and things, I would just avoid touching things and like feeling all the produce, and just limit the amount of contact, for you and for if you've got the virus and you don't know, you're then passing it to somebody else. So just don't peruse the aisles with your hands as much. And then I'd say just at the end of your shopping trip, wash your hands or hand sanitize before getting into your vehicle. So just doing lots of hand washing and sanitizing whenever you can will prevent you transmitting and also potentially getting the virus.
So then you get your groceries home. What do you do?
That's a good question. I think there's a bit of debate on exactly what you should do with your groceries. I think it's very clear you should not be washing like produce with soap and water because there's issues about soap, but you would want to wash your produce with water just like you normally would. There's theories that the virus could stay around on cardboard for like 24 hours. So people sometimes like quarantine it or wipe it down with a wipe and avoid touching it. But doing all of that is okay, but you might still not get rid of the virus. So you do still want to wash your hands the same way you would right before you sit down to eat or prepare food. If you're touching packaging that was in a grocery store, you're going to want to do the same thing.
Okay. So because, stores are closed and anyway, a lot of people shop online. For example, if you shop for clothing and the clothing arrives, what do you do with it?
Okay, that's a good example. I got some clothing the other day.
Okay.
Arrived to my house. I got it from the delivery person and I opened the package and then I threw it out and washed my hands. And then I left the clothes there probably for about 24 hours before I touched it again. So I think like timing out, leaving things so if there was somebody who was infected, that package it, just let it rest for a while. And if you've touched the packaging when it comes in your house, washing your hands.
Okay, well, that's a very good suggestion because I think more and more people, as this has gone on more, are sort of turning to doing that. So now, last, I'd like to have you weigh in on this notion about masks. So early on, we told people that they shouldn't be wearing masks. They didn't need to be wearing masks. But now there's a recommendation, and in some places it's more than a recommendation. It's a requirement that when you go outside, you wear a mask. So let's first just touch on that issue about wearing masks outside.
Okay, so the reason in the outset that people thought that you did not need masks, one was we wanted to reserve the masks for healthcare professionals. And then the second was we didn't know how it was being transmitted by asymptomatic people. And now we have a better sense that transmission is happening. And the key behind the mask is really to protect you from infecting somebody else. The mask isn't going to necessarily protect you from getting the virus from somebody else, particularly if it's a cloth mask.
So we definitely don't want people running out and buying masks that health professionals really need because there's still a shortage for them. So a lot of the suggestions have been that we kind of make these homemade masks that we use. So can you give people a suggestion about that and what type of cloth to use? What should a mask like this consist of?
Yeah, that's a good question. So cloth masks, typically the recommendations are the more fabric, the better. So the more layers, and it's recommended like 100% cotton and around 4 layers is kind of more protective. I personally have bought masks that will tie on so I can fit it closely to my face. There's also versions that will go over your ears and they have like a nose pinch in them, like a metal wire that's been sewn into the fabric. That'll provide a closer fit to your face. So that is important. And then in terms of materials, there's different research ongoing as to what would be protective for inhaling a virus, but in terms of the public health use where we just want everyone to be protecting each other from getting it, even just something over your face, a covering is better than nothing.
Okay, so as we are continuing on this path and now we're all performing all of these behaviors, it seems like some of the fallout from being isolated from other people, from constantly performing behaviors that remind us that there's threat, that there's a lot of fallout from this. There's, mental health problems like anxiety, and then there's just all the disruption that we have to our daily lives. There's maybe difficulty finding the kinds of food that we used to eat. So Sarah, can you talk a little bit about, the sort of secondary problems that are being created by COVID-19?
Sure. I think we've probably all experienced a lot of emotional reactions to this situation. And, I think the most important thing is to remember that these are really common, and that it's okay to feel that way. So, a lot of people have fear and anxiety. Some people have experienced depression. Some of us are bored. You might be angry or frustrated. All of this, I think, is a real threat as we feel kind of isolated in our homes. But I think it's important to realize that there are things we can do to try and alleviate some of that. So one thing is just to acknowledge what's happening and to understand that it's really stressful, and to be honest about that. And as we've talked about in a number of our videos here, is just trying to stay connected with people as much as we can. Another thing is to try and think about finding the benefit in things, even in this kind of situation, to try and kind of look for what is good in the situation. Maybe it's that you're spending more time with your family, or that you're having more time to have that kind of more one-on-one time with people. Breathe. Especially mindful breathing, I think, can be very common, especially if you're feeling anxious. And try to be kind, both to yourself as well as others. So trying to volunteer or do things as much as you can, even if you're in your house, by buying things for organizations maybe that are serving people, or doing those kinds of things. And I think just trying to change your expectations about what you can or should do in this kind of environment. You're not going to write a novel, in our business. You're probably not going to write 18 grants or 3 papers. That you kind of give yourself a break in that way. And then also, I think one of the most important thing is to really kind of manage your news intake, because the news can be very anxiety producing, and just trying to minimize that can be helpful sometimes.
Yeah. And so vis-a-vis your last point, how can people decide what's reputable and what's not? Do you have suggestions for definite sites and sources that you can trust and go to on a regular basis?
Yeah, I think the best thing is to try and moderate your use of many different conduits of information. So trying to stick to 1 or 2 as your main source, and kind of resist clicking on all those links in social media unless you know where they come from. There's a lot of information that circulates on the social media, on YouTube, that are really just wrong, or they're produced by people who really are just trying to sow discord. So it's best to kind of stick to those few that you trust. And what I would say is always stick to the science and to the public health. Those are the people that are on the front lines. They're figuring out what's best to keep us safe, and trying to listen to them is always the best idea.
So finally, regarding all the different sources of information, there's a lot of talk about China, and can we trust information that has come out of China about coronavirus?
China is China. I think it's hard to know if information is coming from not only China, but other countries is correct, given that we haven't done widespread testing in a lot of places, and we're really unsure of how widespread the infection is. So at this point, I think we need to understand what's going on here in the U.S. and how we can protect ourselves and our families as best we can.
Okay. So I think, Graciela, that leads to the whole issue about, do we really need to cooperate with other countries on this issue?
I think very much so. I think there is a lot that we don't know about COVID-19. I think global cooperation is really important in the race to stop the pandemic. The threat of the coronavirus has spread beyond borders to the whole world. So it's happening everywhere in the whole world, and it cannot be defeated by any one country alone. The pandemic is here. And it is important that we mobilize the world to find global solutions. So globally, we need to combine our strengths, we need to pool our resources, we need to share our best practices and our latest scientific findings so everybody can benefit from the knowledge. And this is a public health crisis that affects all of us around the world, so we need to find those global solutions.
Okay, and you would say that not only do we need to share, but there are many things that other countries can and that we can learn from them.
Absolutely. I mean, some other countries, such as in Europe or even China, Japan, South Korea, they are ahead of us in the infection curve. So we can learn a lot from what they are doing. And it's not just that, you know, we are the only ones who can provide the information, but everybody should share the information.
So finally, I want to ask you about people who seem to be suffering or more susceptible to poor outcomes from this virus. And particularly at the beginning of the epidemic, it seemed like there was a lot of chatter on the internet that African Americans were less likely to get it, more immune. Now, the data is showing that African Americans are actually dying at a higher rate. So can you comment on that? What's going on here?
Yeah, it is very sad. African Americans and the poor are dying from the coronavirus at higher rates and getting infected at higher rates. And this is because many say of pre-existing conditions, which really highlight the unacceptable health disparities that exist in this country. But if we dig deeper, we can argue that it is the social conditions that contribute to pre-existing conditions and health disparities. And it is the legacy of discriminatory redlining practices. That means when the banks were not loaning to certain people in certain communities. So these redlining practices left minority communities to face segregation, inadequate housing, poorly funded education, living closer to environmental hazards, further away from healthy nutrition, and et cetera, et cetera, et cetera. And African Americans usually live in communities that are more densely populated and have less access to equitable healthcare facilities. On top of that, African Americans are more likely to be part of the COVID-19 essential workforce, such as bus drivers or grocery store workers, and that puts them at higher risk. And so all those social conditions put minorities and the poor at higher risk from infection from COVID-19. And in my opinion, as Heather said earlier, the best solution is essentially wash your hands with soap and water, use hand sanitizers, practice social distancing, don't touch your face at any time when you're in public in particular, and wear face masks in public. And then that's, you can take control that way.
Okay, well, I think that's it for this week. I just want to remind everybody that there's a lot of talk about that we can all stop sheltering in place, that we can all go back to the lives that we've been living. And I just want to remind people that for guidance, they should look to their local community leader, whether it's a mayor, whoever it happens to be, and the governor of your state. Those are the people that are really going to be guiding what happens more at a local level. So you should stay tuned to your mayor, to your governor, to get guidance as to what you should be doing around that issue. So thanks very much, and we'll have something again next week.